Welcome back to the second portion of the cardiac lecture. I apologize for this being uploaded a little bit later, but needless to say, let's jump into it. So, we talked about the route of blood flow during our last lecture, and we understood that blood was returned to the right side of the heart, eventually making its way to the lungs, and through the pulmonary vein would be returned to the left portion of the heart, and eventually coming down to the left ventricle and ejected through the aorta into the rest of systemic circulation. But it's not just a seamless way for blood to just flow through all willy nilly, right? There's going to be a model atrioventricular contraction where certain things are going to happen to allow this blood to go in an organized fashion. So, as the atria are contracting, the ventricles are relaxing, and vice versa. As the atria are relaxing, the ventricles are contracting. So, as the atria contracts, the atrioventricular valve opens. When this is occurring, the cusp actually project down into the ventricle, and the papillary muscles and the chordae tendineae are relaxed during this time. Okay, uh, when the atria are relaxing, the ventricles are contracting. Okay, blood is being ejected from the ventricles out into the pulmonary and aortic valve. Um, the papillary muscles actually have a very important function during this time. Papillary muscles are contracting, tightening the chordae tendineae. If you guys remember, the papillary muscles are attached to the chordae tendineae, which are attached to the valve themselves. And because of these structures, we prevent a lot of blood going back up into the atria. Okay, this is important. There's conditions in which these papillary muscles or chordae tendineae can actually rupture, right? Or they can just become compromised, and blood will flow back. And this is called, depending on which side it is. If it's the tricuspid valve, it would be something called tricuspid regurg, right? Regurgitation, where blood flows from the right ventricle into the right atrium. And if it's the mitral valve, in which this occurs, we would call this mitral regurgitation, in which blood flows from the left ventricle into the left atrium. So this is important to know the function of the papillary muscles and the chordae tendineae, what they're responsible for doing. They're responsible for preventing regurgitation of blood. So you could see where this could be an exam question, or this could be something that actually, as it actually occurs in real life, this could be something that I could ask. So it's important to know the function of those valves. So here's a picture showing you when the valve is opening here. You've got relaxation right here of the papillary muscle. The chordae tendineae are slack. The cusps, as you can see, are coming down into the ventricle. Blood is flowing from the atrium down into the ventricle. Vice versa here. You have closure of the valve, and you have contraction of the papillary muscle. Okay. Again, this is just another picture here kind of depicting what we were previously discussing. You can see here this is actual anatomy. You guys may have seen this during the cardiac dissection. You can see the cusp of the tricuspid valve here. You can see the three different cusps. You can see the chordae tendineae, which are these string-like attachments which are coming onto the papillary muscle. So we discussed the mitral and the tricuspid valve. Now we're going to discuss the aortic and the pulmonary valve. And again, these valves are named for the structure that they're going to lead into, right? So these valves, so the aortic valve is going to receive blood from the left ventricle. The left ventricle will eject blood into the aorta, but it has to pass through the aortic valve. And likewise, the right ventricle is going to pump blood into the pulmonary arteries, into the pulmonary trunk, but it has to go through the pulmonic valve. So these valves only open, okay, this is an important point, and I want you guys to really hone in on this. The valves only open when the pressure in the ventricle exceeds the pressures in the arteries. So the aorta is, again, this is the largest artery in our body, and because it's the largest artery, it has a great diameter. Because it's a great diameter, there's a lot of pressure that's exerting on this artery. So therefore, the pressure is going to be very high in the systemic circulation. So the ventricles have to have a pressure that's greater than that of the aorta in order for it to open. And once the pressure in the ventricles during ventricular contraction increase, the aortic valve will then open, and then you will have blood flow going into the rest of uh, systemic circulations. So it's also kind of worth noting no valves guarding the entrance to the atria. So as blood flow is coming into the right atrium through the superior vena cava and inferior vena cava, there's actually no valve guarding the entrance to this area. Um, Here, um, as atria contracts, we have compression, which closes the opening. This is how blood flow uh, is. This is how blood is prevented from going out. So this is talking about systemic and pulmonary circulation. We have previously discussed systemic circulation, pulmonary circulation. We know that systemic circulation is going to be the left side of the heart, whereas pulmonary circulation is going to be on the right side of the heart. We said that systemic circulation has more resistance. This comes down to the blood vessels being in series, whereas in the pulmonary circuit, there is less resistance and less pressure. So the left side of the heart has a greater um, has a greater uh, pressure than the right side of the heart. But needless to say, the left side of the heart or the systemic circulation is going to receive blood from the lungs, and we know that that occurs through the pulmonary veins. That's important to know. And we're going to have ejection of blood into the aorta, whereas the pulmonary circulation receives blood from systemic circulation. And we know that is just deoxygenated blood after it's been delivered to the tissues. It then will go through the superior vena cava, the coronary sinus, and into the inferior vena cava, into the right atrium. Blood is ejected into the pulmonary trunk and then the pulmonary arteries. Again, we've went through how this blood actually flows. Gas and nutrients in systemic circulation is exchanged in the capillaries. This makes sense as you're receiving this oxygenated blood. It then goes to the arteries, which are going to feed the different organs and feed the different limbs. And gas exchanges and nutrient exchange is going to occur here, right? We're going to unload oxygen. We're going to pick up carbon dioxide, right? We're going to take it to the lungs. Whereas gas exchange will also occur in the pulmonary capillaries. This makes sense. So we know that veins are going to drain blood back to the right atrium. Again, we're going to go back to the lungs in order to become oxygenated. And the pulmonary veins is going to take blood to the left atrium. So this is a picture here. If you guys are visual people, this will kind of show you a stepwise fashion. I'm not going to go through all these. Again, this is what I've just previously described to you in detail. So coronary circulation. What is coronary arteries? So you remember we talked about the left ventricle and how the left ventricle pumps blood out into the aorta. We talked about there was a portion of the aorta called the ascending aorta. So there's going to be some vessels that come off of the ascending aorta called coronary arteries. So coronary arteries. And these are going to be the arteries that feed the heart. So the myocardium, remember myo meaning muscle, cardium meaning blood vessels. So the inner or the middle portion of the heart has its own network of blood vessels, and these are called the coronary arteries. And that's important to know. If you've ever heard of someone having a heart attack, it's because of plaque buildup within the coronary arteries, right? Cholesterol plaque narrows the lumen of the blood vessel, which prevents blood supply going to the myocardium. Because there's a narrowing of the blood because there's a narrowing of the blood vessels, not enough oxygen is getting to the myocardium. Therefore, it becomes ischemic and people get chest pain, right? Causes a portion of the heart to die if it if it is prolonged. So again, coronary arteries are a branch of the ascending aorta, and they supply the myocardium. Okay. Their purpose is to allow the heart to receive sufficient oxygen. We know that. Also of note, it's often good practice just to just kind of know this. So because there's coronary arteries, there's also coronary veins. Coronary veins collect in something called the coronary sinus. You guys remember us talking about the coronary sinus, how it drained into the right atrium. Just thought I would make that note for you guys. Here's a branch, again, here's the right atrium. left atrium, left ventricle, right ventricle. The left ventricle, again, if you can see in here, it's going to send blood out through the aorta. This is the ascending portion of the aorta. Blood vessels are coming off of here. This is called the left coronary artery. It's going to come down into here. This is called the left interventricular or the left anterior descending artery. It's going to supply much of the left ventricle. The right coronary artery is going to supply the right atrium and the right ventricle. There's a branch also of the left coronary artery called the left circumflex, and it's going to supply the lateral portion as long as some of the anterior portion of the heart. Again, these are just some of the vessels. Of note, the ascending aorta branches into the left and to the right coronary. The right coronary will just supply the right side of the heart. The left coronary will branch off into the LAD and into the left circumflex. Kind of cool. Here's some histology for you guys. Remember, histology is the study of tissue. So of note, cardiac muscle is going to be responsible for cardiac conduction. Right, there's going to be electricity within the heart that's going to allow the heart to beat and contract. So the discs, there's actually something called intercalated discs, and these intercalated discs contain desmosomes. It holds the fibers together, and there's gap junctions. The gap junctions are just going to be this these junctions that allow action potential conduction from one fiber to the next. Mitochondria, if you remember, mitochondria is the powerhouse of the cell, generates a lot of ATP. The mitochondria here are larger and more numerous than they are in skeletal muscle. So I think that's kind of cool. This next picture is just going to be just kind of show you like a cross section of the components of the cardiac muscle fiber. Here you'll see again the different lines you guys can remember in musculoskeletal. You'll see the Z disc here, the M line where myosin is going to be present. This whole thing here is called the A band. You got the I band where actin is present. Here you can see the cardiac muscle fibers as well as the nucleus that's here is the sarcolemma. This is where calcium is going to be stored and released. It's then going to bind to tropomyosin and it's going to allow for cardiac contraction. This is an important slide. This is going to talk to you about the conduction system. And the conduction system is going to be generated due to autorhythmic fibers. And we'll talk about the autorhythmic fibers on this next portion. But within the myocardium, there's going to be an electrical network of cells. And these cells are cardiac conduction cells. And they're going to be responsible for generating electrical impulses, which is going to generate the electricity of the heart. It's important to know this. This is what happens if you go to the emergency department and you have chest pain. They may slap an EKG on you and they're looking at the conduction of your heart, seeing how is your heart contracting, how's the conduction moving, how's it doing. So we're going to talk about this. Okay, we're going to talk about something called the sinoatrial node. This is going to begin. This is an important one. This is the pacemaker of the heart. This is going to determine how fast the heart beats, and it's going to propagate action potentials, right? A nerve impulse through those gap junctions that we previously discussed. But the SA node is responsible for atrial contraction, right? The SA node is going to go through something called the atrioventricular node, the AV node. So it goes SA node to AV node, and this AV node is in the interatrial septum. So you've got the atrium, right? The left and right atrium is divided by a septum. So it's actually inside of that atrial septum. So we know it goes from the SA to the AV, and then it's going to go through the AV bundle of His. Okay? It's going to go through the AV bundle of His. And this is going to be the only site where action potentials can conduct from the atria to the ventricles due to the fibrous skeleton. So in order for us to get to the atrium to the ventricles, we need the bundle of His. So we go from SA to the AV to the bundle of His, and from there, the bundle of His is going to branch into something called the bundle branches. You're going to have the right and the left bundle branch. This is going to go through the interventricular septum toward the apex. And then finally, we're going to have the large diameter Purkinje fibers, which are going to be responsible for contraction of the ventricular myocardium. Okay, so I'm going to show you this on this next slide. Here, this is the SA node. This is, again, responsible for right atrial contraction, and it's then going to go through the AV node. Remember, we said the AV node was present in the interatrial septum, right? So the interatrial septum. So now we're going to branch off into the AV bundle. And again, the AV bundle is going to be responsible, or the bundle of His is going to be the connection point between the atria and the ventricles. And it makes sense because look at the location. You've got the atrial contraction right here, which is mostly present due to the SA and the AV node. But the bundle of His is going to be the connecting point, right? And once we get to the bundle of His, which is present right here, we're going to branch off into the right and left bundle branches. Okay, here's you're going to have your right, and here you're going to have your left, and the right and left bundle branches are eventually going to branch off into the Purkinje fibers. Okay, the Purkinje fibers, it's important to know, are responsible for ventricular contraction. Do you remember which are responsible for right atrial contraction? That's right, the SA node. Absolutely. But again, this is just how cardiac conduction occurs. I think it's important for you all to know this. This will be tested, especially knowing the sequence of conduction from the right atrium down to the Purkinjes. I would hope that you would study this. So we talked about the conduction system, and we said that it was largely due to these autorhythmic fibers. So these autorhythmic fibers are going to be specialized cardiac muscle fibers, and they have two important functions, which I want you to know. They act as the pacemakers of the cells, and they form the conduction system. So they repeatedly generate action potentials that will then trigger heart contraction. Again, autorhythmic fibers, and they're self-excitable. They require no other input. They stimulate themselves, and that's unique because no other cells in our body are like this. And I believe this is where we will conclude the second portion of the lecture preview. So if you guys have any questions, please feel free to reach out to me. Again, we're going to cover this in the lecture today. I apologize for the delay in uploading the lecture, but I hope you guys have a great rest of your day. Thank you so much.